knowledge about how your body works, how your gut works, how it's all integrated, that is real power. And so if I can give people these questions so that they can go ask their doctor and maybe get off the Nexium, maybe the doctor will be like, yeah, you know what? You actually don't really need the Nexium.
Hi, it's Dr. V, triple board certified MD and performance and longevity expert, and I want to welcome you again to another episode of the Thrive State podcast. On this episode, I actually get a chance to converse with one of the most recognizable faces in gut health and gastroenterology, Dr. Robynne Chutkan. Now, today is all about our gut, but our gut is tied to everything. I mean, if you read my book, Thrive State, you'll understand that there is an ecosystem in our body. And within an ecosystem, there are three main traits that I find that are most important for the survival of the ecosystem, for the ecosystem to thrive. That's number one, independence. Every member of the ecosystem has an independence, has a purpose, has something to give. The second thing is that interconnectedness or interdependence. And that's when somebody can give their gifts to other people. In an ecosystem, that's what is needed. It's needed for everyone to be at their best, but also serve themselves to other people for the good of the entire ecosystem. And the last thing is state. The state of an ecosystem determines how that ecosystem is going to do. Take, for example, if, you were an ecosystem of cells in a petri dish, and I put you inside an oven. Well, all of a sudden the state changes and everybody gets stressed out, right? So state is super important. And the thrive state in ecosystems makes an entire ecosystem thrive, just like the thrive state is in our body. Our whole body is basically an ecosystem made up of individual cells. Those individual cells form tissues, form organs that serve other cells and organs in the body. So everything is connected. And you'll learn in this episode just how important the gut is. The gut is basically a very small, thin lining, but it protects us from the things that we ingest to the outside world. There are 70 to 80% of our serotonin lives in our gut. So it's really important for our mood. It's connected to our brain. So how we think, how we move, how we behave is also gut related. And so much of our immune system is also in our gut. It keeps us healthy. But if our gut is not in a good state, if there's some dysbiosis, well, guess what? There's a lot of autoimmune conditions as well as other physical symptoms that come from our gut not being in health. This is why today's episode is so important. Now, before I introduce our guests, let me just ask you to do us a favor. If this content is bringing a lot of value to you, please do us a huge favor by leaving us a 5-star review wherever you're hearing the podcast. And if you haven't picked up a copy of my book, please do so at thrivestatebook.com. Now, let me introduce our next guest. She's the best-selling author of multiple books, including Gutbliss, The Microbiome Solution, The Bloat Cure, and her newest book, The Antiviral Gut. She's actually originally from Jamaica, but she received her bachelor's degree at Yale University and her medical degree from Columbia University. And she is now also an assistant clinical professor at Georgetown University. She speaks all around the world in some of the most biggest conferences all around digestive health. She's a wealth of knowledge, humor, and a lot of positive energy as well. You'll get to meet her in this conversation of the Thrive State podcast. Ladies and gentlemen, Dr. Robynne Chutkan.
There she is, Dr. Robynne Chutkan. Welcome to the IG Live edition of the Thrive State podcast.
Thank you so much. It's so great to be here. And it's so fantastic to connect with all these new people through the book. Thank you so much for hosting me.
Yes, well, I am super excited to dive into this book here, The Antiviral Gut. And I got to say, I've been watching, or just recently, the career that you've crafted for yourself since leaving medical school and your training, and it's very inspirational. Love to dive in and learn more about that after the show.
Thank you. Thank you. Yeah, well, I was looking at one of your videos, stalking you a little bit in preparation for the live. And one of the things that you talked about really resonated with me, which is this idea of, you were making a really good living. I saw the Porsche, everything was fine, but you felt like there was this sort of deeper meaning and purpose missing. And I think a lot of us in medicine, while we appreciate the conventional healing and all of that, feel like there's a deeper message that we have that we want to take to more people, and how can we do that? And obviously books are a great way to do that. Your platform is a great way to do that, to go sort of beyond, in my case, beyond the scope, beyond doing colonoscopy, beyond people and writing prescriptions, which certainly has its role, right, and can be really helpful. But to take what I've learned in the 30 years since I graduated from medical school and figure out a way to sort of get that out to people. So I think we're on the same journey.
Well, thank you so much for being a great model for the people who have gone through the traditional medical route in terms of, even opening up, how we think about medicine. And we'll dive into that in a little bit. Now, we start off the show, and the people know that we do a small little game show segment called the 5 to Thrive. These are 5 quick questions meant to be answered in less than 30 seconds. Just a little to get to know you a little bit better. 1,000 points each, and I owe many people dinner. Now, if you get them all right, you get a nice, healthy dinner that you pick the next time we get together. So let me ask you, Dr. Chutkan, are you ready to play?
I'm
5 to Thrive.
ready. Let's roll.
Here we go. Question number 1 was, what did you want to be when you grew up?
I wanted to be a linguist.
A linguist. Tell us a little bit more about that.
Yeah, I speak Spanish and French and some English. I was really interested in languages. In fact, I took a gap year between high school and college and went to France for 6 months, spent 6 months at the University of Salamanca. Love languages. Like wherever I travel, I was in Turkey recently. I love to learn just a few phrases so that I can connect with people. The problem is then you say something and people think, oh, she really speaks this language, and then they go on. But I feel like language really unites us. I watch films in different languages thinking like, oh, if I watch this Korean series long enough, I'm going to learn how to speak Korean. So I'm still pretty obsessed with languages. Love it.
Amazing. 1,000 points there. Question number 2 was, if I handed you a mic, put you on stage to sing a karaoke song, what song would that be?
I have nightmares about this. I am so tone deaf. I speak languages and I have a good ear for languages. I mean, if you don't know the words to the song I'm singing, you're not going to know what it is. But it would probably be Buffalo Soldiers, Bob Marley.
Buffalo Soldier,
I hail from
yes.
the homeland, from Jamaica. So I think that would have to be it.
All right. Question number 3, you're doing awesome, is what's your favorite holiday?
I love Thanksgiving. It's not a holiday I grew up with. I grew up in Jamaica, Bahamas. But I love the time of year with the fall foliage. You can see the leaves outside behind me. I'm sitting in my bedroom. It's right on the heels of Halloween. So it's a fun time of year. And I love all the traditions around it, even though, again, they weren't traditions I grew up with, but I've embraced them. Oh,
awesome. Question number 4 was, what book in childhood made the biggest impression on you?
This is a hard one to admit, but I read a lot of Enid Blyton as a kid. She's a British author, and I say it's a difficult one because now as an adult and as we are all generally more woke as a society, going back and looking at Enid Blyton books where she talks about goblins and so on, and gollywogs, there's a lot of racial stuff in there that's not cool at all. But I will say as a kid, I loved anything and everything Enid Blyton.
Oh, awesome. It's 4,000 points. Will she get the last one? The last question is, what one thing have you learned that you think, is the favorite message you'd like to impart to your children?
Dirt, sweat, veg. Get outside in nature, get a little sweaty, eat some vegetables. If you do those 3 things, everything else will just sort of take care of itself. Those are the 3, the ride or die, dirt, sweat, veg. That's awesome.
We're going to get a little bit more into getting dirty a little bit later. Now, I want to ask you, because I was a conventionally trained doctor as well. I trained after you, but I don't know if you heard of the microbiome during residency or medical school. Was that something you got trained in before? And what was it like to integrate the concept of the microbiome into your new practice?
it's kind of crazy that I think we all miss this. You know, we were busy in medical school and residency, like getting super clean, right? Figuring out how to get rid of. And certainly that's important when you're, say, in an operating room or doing something like that. But we, I think, totally miss the boat in our medical education, this idea that germs are actually more friends than foes. So it's been a gradual evolution. And it really, for me, it was a result of the circumstances around my daughter's birth about 17 and a half years ago. She was a C-section baby. So of course you miss out on that passage through the birth canal and the colonization with the mother's microbes. She was minimally breastfed because my breast milk dried up after about 6 weeks. And then she was on antibiotics at birth because I had the flu when I had her, even though she was perfectly healthy. So she got 2 strong doses of an IV antibiotic at birth, missed out on the birth canal colonization, missed out on the important HMOs, the human milk oligosaccharides in breast milk that are designed to feed the baby's burgeoning microbiome, and then got really just pelted with antibiotics about every month to 2 months for her first few years of life. And she was a really sickly baby and child. And I was a first-time mom. And even though, you know, I had fantastic medical training at Columbia and Mount Sinai, et cetera, I didn't know that babies weren't supposed to be sick every 2 months. I mean, this was just sort of my normal. And it took a while to realize that something really not good was going on. And it was in her microbiome. Those first 1,000 days of life, as you know, are so critical. The first 1,000 days of life in terms of the baby's burgeoning microbiome. And that's when my kid was just being hammered with all these antimicrobials. So I realized after a couple of years that we were going to have to change course. And I also am quick to say that as a physician, I was able to stop taking her to the doctor. I don't advocate that people stop taking their kid to the doctor, but I was able to do that because I'm a physician and I could tell when something was serious, when it wasn't. And we just had to, you know, we had to find another path from ear infection, equal antibiotic, pharyngitis, equal antibiotic, cough, cold, equal antibiotic. And it took a few years, but through lots of lentil dal burgers and split pea soup and green smoothies and just really avoiding the antibiotics unless they were absolutely necessary, she got healthy. And she's now a senior in college, a rower. We were at CrossFit yesterday. She was kicking my butt. She was looking at what I was deadlifting and like, oh, come on, is that all you got? So she's super healthy. And you know, it was a long road, but I started seeing the same picture with a lot of my patients with autoimmune diseases. A lot of my patients with Crohn's, ulcerative colitis had this same history of frequent antibiotics in childhood. And then we had an article from one of our big GI journals, Gut, that came out in 2014 showing that frequent antibiotics in childhood was one of the major risk factors for developing Crohn's in later life. And we've seen that data replicated over and over again. So we know that that early hit to the microbiome can be really problematic and is one of the contributing factors for autoimmune diseases. So that really opened my eyes. And for me, I wish I could have a do-over for that, you know, for a lot of her childhood. And she was so sick. And even now when she's like back talking me, I'm like, it must be the microbiome. Although I think that's just 17-year-old girl talk, but I am really grateful for that experience because it truly opened my eyes to the importance of the microbiome and that it's multifactorial, right? But most diseases don't just fall out of the sky into our laps. They're made, not born. And we were on a path of making disease with all these frequent unnecessary antibiotics.
Yeah, now I know you're on the faculty of Georgetown University, and I wonder when will conventional medicine kind of pick this up? Because, you know, my daughter was born with an emergency C-section as well, and when I brought up the issue of maybe trying to do a vaginal swab and to inoculate my daughter, she was like, no, we don't do that. Are you finding that more institutions are starting to do this, or are we really, really far behind? I think
really slow. And you were ahead of the game with your daughter. So, you know, Marty Blazer wrote that great book, Missing Microbes, over a decade ago. And he was head of infectious diseases at NYU. So as I like to tell people, when the head of infectious diseases at a major medical center is telling people, beware of antibiotics, like, you know, there's a problem. So I thought when that book came out that it would sort of reverberate, but it really hasn't. And it's his wife, Gloria Domingo Belez, I think her name is, who's an incredible researcher in this area, who came up with this idea of vaginal seeding, just what you said, taking a little gauze, dipping it in that perineal area, and then swabbing the baby after C-sections, which studies have shown can be a really valuable way of kind of reseeding the baby. And so low tech and cheap, right? I mean, a piece of gauze, and it doesn't even need to be sterile, because we're not talking about a sterile area, you know, that area there, the perineum. The whole point is to get the baby sort of dirty, if you will, with those microbes. When I wrote my second book, The Microbiome Solution, which came out in 2015, so 7 years ago, I wrote a whole birth plan in that book, and I talk about this. And I tell you, my OBGYN friends, they weren't speaking to me. They were like, why are you telling people this? And C-sections. And I'm like, but C-sections are associated with an increased risk of autoimmune disease, allergies, asthma, and obesity. And people need to know that. Like, you may still need a C-section. I needed one medically, maybe. You may need one. Your daughter maybe needed to be born via C-section. But for all these people who are electing to have C-sections, they need to know that there's a price to pay on the other end. So I'm taking a long time to answer your question. To answer your question, I think it's been much slower than I would have liked to see, and that it should be based on the amount of evidence we have in the medical literature. I mean, the scientific data about the harms of overusing antibiotics and not using them judiciously is incredible. And I think about it a lot, and I think it must have to do with the incredible commerce in the pharmaceutical industry, right? Like the budget, think about the advertising budget of the average pharmaceutical company. It dwarfs any sort of PSA budget, right, for letting people know. But I think what's going to change it is lawsuits. I think when people start having class action lawsuits for antibiotic injured, it will change. I think it's going to have to be an economic incentive.
Yeah, so happy that people in your position are talking about this. Now, I really want to dive into this excellent book, her new book, The Antiviral Gut. And you start off the book talking about this cruise ship that was, I think, leaving the port of Japan back in 2020 when the pandemic was out, and there was an outbreak of COVID on the boat. And you've got probably 1 in 5 people that got infected, but you got certain people that had mild symptoms, and then you had other people that, had more major symptoms and then death. What is causing the difference here? And I think that was probably an impetus of why you put out the book. Can you explain a little bit as to why gut health can make people more susceptible from an immune standpoint?
This episode of the Thrive State podcast is brought to you by the Thrive State Accelerator. The Thrive State Accelerator is actually a home course that I developed using the exact same techniques I work with my celebrity clients, CEOs, and executives on how to get them to the Thrive State. The Thrive State Accelerator teaches you how to master your 7 bioenergetic elements. That's sleep, nutrition, movement, stress and emotional mastery, relationships, our thoughts and mindset, as well as purpose. In this Thrive State Accelerator, you're also going to get a bonus module on optimization. That's how I talk about supplementation, peptides, all the optimization techniques I use with my clients to get them to the Thrive State. Now, for some of you who are just joining us for the first time, you guys might be wondering, what is the Thrive State? Well, the Thrive State is actually the energy, the epigenetic environment we give to ourselves, telling our DNA how to act and how to respond. And if we want optimal health, longevity, and peak performance, if we can master these 7 bioenergetic elements, our ability to have those 3 things that we just said, optimal health, longevity, and peak performance, is at its greatest. And it also prevents you from getting chronic symptoms like brain fog, being overweight, feeling sluggish, acne, pain, all these chronic symptoms, as well as preventing you from getting chronic disease. So getting to that Thrive State is really getting to that state to master being that very best version of yourself so you could show up for you, for your family, for your business, everything that's important to you. So go ahead, check it out right now at canvu.com/accelerator and use coupon code podcast25 for 25% off. Now back to the podcast.
Absolutely, Ken. It's really the whole crux of the book. And it was a question that plagued me so much during the pandemic, because people were terrified. Everybody was terrified. And it was a terrifying time, to be clear. But I kept saying, we can stratify risk. Like, we know, we can predict who are the people who are going to be on a ventilator, who are going to be in the ICU, who are going to be hospitalized. And a lot of the people who are panic stricken, I was like, and it's not you, you don't need to be worried in that same way. Now, of course, there is the exception to every rule, right? And every now and again, there is this sort of aberrant result. But to your question about who is asymptomatic, who makes a full recovery, who ends up plagued with post-viral symptoms, and who doesn't survive at all, this is this concept that the health of the host matters. And that host health, in fact, is probably more important than the potency of the pathogen. And, it's such a basic concept, because if you think about it, if you think about somebody having a heart attack, an 85-year-old who has obesity and is diabetic and hypertensive and smokes, having a heart attack is not going to do as well as a 35-year-old ultra runner who's super healthy, right? So we see this all the time. We see this with outcomes from cancer, from infection, from autoimmune, from anything. But yet when you say it with viral illnesses, people think that this is like a strange new concept, that of course it's not random. Of course it's predictable. And one of the major studies from this pandemic was showing that the health of the gut microbiome can predict outcome from COVID with 92% accuracy, which is, even for somebody like me who studies this stuff, is remarkable, right? Looking at the relative amounts of Faecalibacterium prausnitzii as a bacteria that's correlated with good outcome, and Enterococcus faecalis as a bacteria that's sort of correlated with poor outcome. But when you also, on the flip side of that, realize that your gut microbiome is a more unique identifier of you than your own DNA, it tells us more, we can recognize somebody with more accuracy looking at their microbiome than their DNA. Then you start to go, okay, well, now I can maybe see how this thing is really predictive.
Yeah, so let's dive in a little bit more on this microbiome issue. You mentioned I'm going to just read the quote here from Deepak Chopra. By creating an artificial environment, we are not stimulating our immune system enough. Germs are immune stimulants. They challenge you to be prepared.
Each chapter, as you know, starts with a quote, and that was one of my favorites from the man himself. And it is this idea of being too clean. And, David Strawn, an epidemiologist from the London School of Tropical Medicine and Hygiene, he was a person who sort of, created this concept of the hygiene hypothesis. And that was based on a study, 21 years, studying over 17,000 kids from birth to adulthood in post-industrial London to figure out why they were seeing such skyrocketing rates of autoimmune diseases. And he found two really startling findings. First was that kids from large families who were being sneezed and coughed on and, having the usual childhood illnesses, those kids almost never had autoimmune diseases as adults. The other thing was that kids from small families that were affluent, and back in post-industrial London, affluence was associated with lots of bathing. Not so much now. I know rich people who bathe a lot, and I know poor people who bathe a lot. But back then, in terms of sanitation, most people didn't have indoor plumbing, etc. And so the more affluent families were bathing and clean a lot. And they were the same families who were being stricken with autoimmune disease. So this was a basis for what we now know as a hygiene hypothesis. And the really cool thing is, if we look at a map of the world today, we still see those differences. They're changing, but we still see high rates of autoimmune disease in North America, in Western Europe, and low rates in Sub-Saharan Africa and Southeast Asia. And of course, as countries become more industrialized, not only because of the McDonald's effect, but because of things like chlorine in the water, which is actually a good thing, right? I'm glad I don't have to worry about getting cholera from the water. But as countries become more industrialized, more sort of super sanitized, where the food becomes more highly pesticized and processed, and there's wide use of antibiotics, we see these rising rates of non-communicable diseases like autoimmune disease. So the thing that I wrestle with a lot is, how can we rewild ourselves without going all the way back to the cave, right? How can we increase the microbial diversity and richness in and out our bodies while still enjoying some of these modern conveniences that we all enjoy?
Yeah, so let's tie it all together for people. So we basically have this plethora of different microbes in our gut, and the gut is really associated, probably about say 80% of our immune system lives in our gut, and that balance there balances between our immune system and being able to fight off pathogens, but also not to haywire our immune system so it attacks on ourselves. This is why when we have an imbalance of our microbiome in our gut, it can lead to potential diseases like autoimmune disease, which is what you talked about.
Absolutely. And I'm so glad you pointed out that 70 to 80% of the immune system being physically located in the gut, right there on the other side of the gut lining. So if the gut microbes are out of whack, if the gut lining is damaged, these are things that can profoundly affect the immune system. And like you said, immune balance. So if you have an immune system that's too active, you're going to end up with autoimmune disease or severe allergy. If it's not active enough, you're going to end up with cancer, because the immune system is also a cancer surveillance system, or you're going to end up with infection, not being able to clear viral, bacterial, parasitic infections. So the goal is that Goldilocks immune system. And how do we get a Goldilocks immune system? We got to have a healthy gut.
So let's dive into that, because you give great tips as to how to keep our gut healthy, and also the things that damage our gut as well. And so let's just talk a little bit about the things that people are doing every day that is, potentially causing some dysbiosis. Let's talk a little bit. You talked about antibiotics. You basically kill off all the bacteria in your gut. So unless you really need to take it, and in the book, she actually gives questions you could ask your physician to determine whether you really need antibiotics or not. But let's talk a little bit about proton pump inhibitors, and then some other classes of drugs that might be damaging to the gut.
Yeah, PPIs. I mean, you can't leave a gastroenterologist's office without a prescription for a proton pump inhibitor. It is, my colleagues give this stuff out like candy. And proton pump inhibitors are really popular drugs. They used to be amongst the third most commonly prescribed drugs in the world. I think they're still top 10. But they're really popular because they're really good at what they do, which is completely shut down the proton pump in the stomach that's responsible for creating the acid. And so that means that you can, eat a porterhouse and fries at 10 o'clock at night, and you're not going to have that typical heartburn. But it also interferes with digestion dramatically, because we need an acidic milieu to assimilate and absorb the nutrients, the vitamins, etc. So you completely mess up digestion, and you also sabotage one of your body's main antiviral defenses, because stomach acid, in addition to being there for digestion, is there to protect you from pathogens, which often get in through the mouth, denatures viral protein, renders SARS-CoV-2 inactive, but only if you actually have stomach acid. So for those millions of people out there taking proton pump inhibitors, there are some conditions where a proton pump inhibitor is actually indicated, but the vast majority of people taking these drugs are taking it for heartburn that can be treated with diet and lifestyle. So that was one of the things in this book that I'm most proud of, is a plan and really going deep. In the medicine cabinet, as you saw, I tell you questions to ask your doctor, alternatives, this is how you taper off the drugs. These are the indications. I will occasionally, I won't say hate mail, but I'll occasionally get a stern email from a GI colleague. It was like, oh, one of the patients came in and they've read your book and they're asking me all these questions I couldn't answer and being really annoying. And I'm, yes, again, like, we're both very much, we have the same passion, which is power to the people, right? We want to put the power in people's hands, and knowledge is power. Knowledge about how your body works, how your gut works, how it's all integrated, that is real power. And so if I can give people these questions so that they can go ask their doctor and maybe get off the Nexium, maybe the doctor will be like, yeah, you know what? You actually don't really need the Nexium. You can take some Tums when you have reflux. We have just dramatically decreased somebody's chance of getting COVID. We know from a large population-based study in 2020 of 53,000 patients that being on a PPI once a day doubles the risk of testing positive for COVID. And being on it twice a day, 3 to 4 increased risk. And that's not just COVID, that's true for multiple different viruses and bacterial pathogens. So being able to sort of reinstitute someone's stomach acid, that makes me really happy.
Well, that's a great point. And like you said, if you do have reflux, consider diet and lifestyle type changes. I just wanted to hit one other class of drugs because I know people are on it a lot. You know, the mucous membrane is such an important
Yeah,
barrier in our
of
gut.
course.
And when we take NSAIDs or when we take painkillers, it weakens that, correct?
Yeah,
Okay.
it's literally poke holes in our gut lining and very
Yeah.
deleterious to that intestinal barrier. And remember, that barrier is the only thing protecting you from the outside world and protecting your body's inner contents from the outer environment in your gut. So NSAIDs really keep us in business as gastroenterologists, not just with ulcers, but also with increasing intestinal permeability, etc.
Okay. Well, in this last segment, I know we've only got 5 minutes left. You know, people want to know how to keep their gut healthy. Can you talk a little bit about prebiotics, probiotics, postbiotics, and how to find or take the right ones?
Sure, absolutely. So prebiotics refer to the food that the gut bacteria eat. And I like to reinforce here food, not the supplement, but the food primarily. And so we're talking about high fiber foods, what we call MACs, MACs, microbiota accessible carbohydrates. So that would be things like leeks, onion, garlics, foods that are high in inulin. It would be oats, beans, anything fibrous with a high fiber content typically are the prebiotic foods. Probiotics, of course, refer to live bacteria, but the World Health Organization definition is live bacteria that when ingested confer a benefit to the host. And I always remind people about that second part of the definition. So if you're taking a probiotic and the bacteria are dead, they're not actually making it to the gut to colonize your colon, that really doesn't qualify. So I really like people to focus on the probiotics that are in their gut already and thinking about how they can feed them with the right prebiotic foods. Postbiotics refer to the metabolites that the bacteria make. So that would be things like short chain fatty acids, butyrate, propionate, etc. Short chain fatty acids are really essential to maintain a healthy lining for the gut lining, and they also help modulate the immune system. So if you think of a food like fermented foods like kimchi or sauerkraut, you're getting the prebiotic with the fiber that the food is made from. You're getting the probiotic because in the fermentation process, you're creating live bacteria, and you get postbiotic. So to me, you know, getting the stuff from food is always a preferable way to do it. For people who are concerned, who've had an antibiotic, etc., I have a whole section in here on how to choose a probiotic, what to look for, refrigerated versus not, how many strains, how many colony forming units, etc. So I think it's helpful to really think about what you're trying to treat, because if I'm using a probiotic in somebody with ulcerative colitis, for example, that's a different probiotic choice than I would make in somebody who I'm treating with traveler's diarrhea. So it's, you know, there is some technicality to that, but I dive into all of it in the book.
That's excellent. You know, and in the very last section of the book, you really talk about a holistic approach to gut health. And I was wondering if I was reading my book, Thrive State, because you talk about sleep, you talk about, you know, stress reduction, you talk about exercising every day and really, you know, making the right choices, creating an energetic environment for your gut and for your body to actually heal and to perform at its best.
Yeah, again, we're speaking the same language. You know, the data on the role of sleep and stress with the immune system. I mean, a study last year showed that people who are chronically sleep deprived, 76% more likely to come down with COVID. And we know the same thing for stress. It's a major risk factor for viral infections. So I think, you know, Thrive State is talking about the state that you need to be in to have an antiviral gut. I mean, it's again, we're all connected and speaking the same language for sure.
Which is why the antiviral gut is also the anti-aging gut as well. Thank you so much for sharing this information. Tons of questions we didn't get to, but this was super, super exciting. Where do people find more about your work and everything that you do?
They can find me at Gutbliss, where we are here, where I've joined you, and also RobynneChutkan.com, RobynneChutkan. The will also take you there too. We're having actually a really terrific free masterclass in February. Everybody who orders a book, you just have to upload the order information, and I've compiled an incredible faculty, people from conventional medicine. I have acupuncturists, meditation experts, so many great people joining. And so that event is going to be in February. So I hope everybody joins us. It's free and it's going to be fantastic.
Definitely do that. Last question for you, Dr. Chutkan. With everything that you've seen in medicine and life, what has been your best medicine?
Food. Food. And, somebody said to me the other day, they had held up a pint of Haagen-Dazs and were like, well, you don't eat this. I was like, what are you talking about? Of course I eat Haagen-Dazs. I mean, not daily, but, I eat ice cream. So it really is a sense of balance, and it's less about what you're eating that's bad and more about what you're missing. Like literally pick up a carrot, chew on a piece of celery. So it really, for me in my practice with my patients, especially, we're talking about people with complicated autoimmune diseases, and seeing the power of food with changing the diet to heal what's going on in their gut, nothing short of miraculous.
You are your best medicine. So are your choices. And thank you, Dr. Chutkan, for being on this IG Live edition of the Thrive State podcast.
Thanks, Dr. Vu.
I hope you enjoyed that episode of the Thrive State podcast. And if this podcast is bringing a lot of value to you, if you find that your life is just improving with this podcast, that your life is getting to the next level, please consider supporting it. And here's a few ways you can do so. You can do so by liking this video and commenting on this video, and also sharing this video with your friends and family. Another thing you can do is go to ratethispodcast.com/ThriveState. Go ahead and leave us a 5-star review there. It will really, really help this show grow. And this will give me more time so that I could actually give more content to you, just like you got in this episode. And if you haven't already picked up a copy of my book, Thrive State, Your Blueprint for Optimal Health, Longevity, and Peak Performance, you can pick it up now. It became a #1 new release in longevity. Go to thrivestatebook.com. And if you enjoy the book, please consider leaving us a review as well. And the last thing you can do, if you're liking everything here and you want to work more closely with me as well as my team to get you into the Thrive State, go to kianvu.com/accelerator and consider joining the home course, the Thrive State Accelerator. It's really the course that I use. It's the concepts that I use personally when I work with CEOs, celebrities, and my high-profile clients to get them to the Thrive State. Again, the Thrive State Accelerator at kianvu.com/accelerator. And because you're a listener of this podcast, I want you to save 25% by using the coupon code podcast25. I hope we continue to give value to you. And remember always, you are your best medicine.